I wondered if you could just both reflect on sort of just as we go into sort of launching and publishing sort of the next iteration of the pathway, what you think the next steps are for it now. Peter, can I start with you?
Yeah, thank you, Paul. I'd just like to make clear that whilst the Harm Patients Alliance and AVMA have led this initiative, it hasn't been in isolation. That we've consulted very widely. We've engaged with people who've got lived experience of healthcare harm, and we've engaged with NHS bodies and bodies such as the Healthcare Safety Investigation Branch, as was. Um, so all of that has got us to where we are. I think now what has to happen is that organizations need to get to grips with the Harm Patients Pathway. And if they can sign up to its key principles and its core commitments, then make a start. Um, they will not be perfect from day one. It will take work, but help, advice, and possibly training is available for them to help them in that journey. So we want people to actually feed back their practical experience of trying to live up to these expectations and responding in the way that the Harm Patient Pathway uh, asks them to. We also need the national bodies to really get behind this and promote it. We've all heard about the dreadful way that some people in the high profile scandals in the NHS have been dealt with. Everyone accepts it's totally unacceptable. Well, this is a practical opportunity to actually start changing that. So from the top to the bottom, we want people's support. We want people to try implementing it and actually feed back their experience so that we can make this even better and clearer for people in the future.
Mm. That's really helpful. Thank you, Peter. And you're absolutely right, Peter, that this has not just been a kind of two organisations coming together who've kind of come up together and come up with this. Certainly, yes, we've shaped it, but there's been, as you say, huge involvement from many, many other people outside of this discussion today, all of which are owed a huge debt for their contribution to this. So we're immensely grateful to them. So thank you for making that point. It was, yeah, really important to make. Joe, thoughts from you about next steps for the harm patient pathway and where it needs to go now, where you'd like it to go now?
Mm. So, obviously, it's very similar to Peter. For me, I just hope that anyone looking at the documents, exploring what it is, whether they are right at the top of the system, making national policy decisions that impact upon organisations, or somebody right at the front line who's looking at it and thinking, what does this mean for me in terms of how I'm interacting with patients and families? I really do think that the next steps, just keeping it simple, it is to really ask oneself if this commitment to supporting healing after harm is absolutely one that, that we're making with conviction. And then from there, that exploration of the commitments and the essential elements, and the looking to see what is within my gift to achieve, what is in my gift to enable others to achieve, and working on that. So, as Peter said, for people to pick it up, to commit to the intent, and then do that honest review around where we are and what are we already doing? What can we do now, but also not be afraid to say, and we do have that vision that that's where we want to get to. We're not right there now, but that's okay. We'll start working on it. So for me, it is anyone, regardless of level, thinking what they can do and also what they can enable others to be able to do so that this can really fly. Yeah.
I mean, going back to the earlier discussion about some of the barriers and the challenges, I mean, clearly there are barriers and challenges. We know the NHS, I mean, we're recording this in winter, and winter pressures, flu epidemic. We've got all of those challenges, all of which could be reasons to say, well, we'd like to do it, but we can't do it now. We'll need to think about this in the future, 5 years, 3 years, whenever it might be. And I wonder, Joe, just to go back, I mean, you mentioned the individual asking themselves what they could do. I mean, we see this as an organizational set of commitments, but actually, if you work in an organization that for whatever reason isn't able to commit to it, do you think as individuals people can commit to it? And actually that's still a possibility to make that difference?
I think that if the mindset is patients and families who come to harm are ours, there are patients and families. So I hear people talking a lot about when people are receiving clinical care, that's my patient. There are patients on wards ZB, or I've seen that when there's been harm to a child and sitting with staff afterwards and them saying she was our patient. And I just think this sense of that same feeling of these are our patients and families afterwards, and letting that guide the approach that's taken, and just checking ourselves for anything that starts to creep in of, oh, potential problem. Can somebody have a look at that to make sure we're not saying anything that could get us into difficulty? Those types of things. Just everyone checking self on that would make a huge difference. There are, I'm not saying that is the mindset of everyone, but there can be certain influences, processes, or protocols that can perhaps make that thinking start to kick in. And I suppose if we just start to notice when it does and question why that's happening, and if that fits with the commitments within the pathway, then that could help. But absolutely, your question was, can individuals do this without the support of their organisation? I think we're asking organisations to enable, aren't we? Anyone at any level to think this way and act this way and do what they can from the pathway.
So clearly there's been a lot of work to get to this point. I mean, just listening to both of you talking about what's gone on, and I know that this has been a journey that's been, quite some time in the making, as we've co-produced it and involved so many other people along the way. So it's not just been a AVMA and the Harm Patient Alliance. There's been many people involved in and contributing to, including a very wide public consultation, which got a huge response to it, huge positive response, I should say. So really helpful. But there's still a lot more to do, and we're at this sort of critical moment where we're about to put it out there, and we want people to embrace it, and we need to encourage them to do so. So my question, I guess, to both of you is, so what's the one practical thing that you would like listeners from today's podcast to take away from this discussion about what they might do, or just a reflection on what they've heard? Peter, can I go to you first?
I suppose the main message I'd like people to go away with is that there's real help here in the form of the Harm Patient Pathway to actually make a start on responding to harm patients and their loved ones in the way that people in their hearts would like to. And we know that from speaking to staff. And that it's achievable. Not everything could be conquered in one day, but by making a start and becoming familiar with the Harm Patient Pathway and everything in it, by seeking advice or help with it if they need it, people can make a start on at least knowing where they are at the moment and improving on that. Going forward with people's feedback and advice, I know we all believe that this is going to be developed further, based on learning from people's practical experience of implementing it. And we also hope to provide further guidance and resources for people to help them do this well. But make a start. It is achievable.
Okay, so your message there, Peter, make a start. It is achievable. Joe, do you have any thoughts about practical things that people who've been listening to this today could take away?
Yeah, so I think for me, the key is connection and curiosity. So we're so used to, I think, when things happen, looking for what's the process, what's the protocol that's going to tell me what to do. And I think one of the key messages from us with the pathway, isn't it, that these are commitments and essential elements to commitments. But really what they're all saying is listen to the harm patients and families. Ask them, how have you been affected? What matters most to you about what's happened here, and what matters to you now about what happens next? What do you need now? And be responsive to that. So what we're trying to do with this work is enable each harm patient and family to be able to take their own path from harm to healing, and to open up dialogue between them and those that are responding to them, that enables everyone to be working towards that same common goal together. So co-creating a pathway from harm to healing with each individual family. So my takeaway really is ask. Don't be afraid to sit, to acknowledge harm, to say that everybody is obviously desperately sorry for what's happened. How are you affected? What do you need? And what can we do? And have that sort of willing nature, and then co-create that path with your harm patients and families together. And I think, as Peter said, this approach, we know that restorative principles closely align with healthcare principles. And so it really is living the values, isn't it? To sit down with somebody, to listen, and then to look at what we can provide to respond in order to support health and well-being. And it's all the same stuff that people are used to within clinical care. So yeah, thank you.
Thank you so much for that. You gave me two lovely, a nice segue there was you gave me 3 C's. You gave me connection, you gave me curiosity, and of course we've got commitments, which make up the pathway. So we've got 3 C's. So thank you so much for that. And thank you so much for this very kind of thoughtful and grounded discussion. I hope that listeners will take away that the harm patient pathway isn't just a document. It's a set of commitments about doing the right thing by patients when things go wrong, which sadly from time to time they do. So thank you to everyone for listening and for engaging in what is really important work. And I hope that listeners of this today will take away the commitments, look at them and think about how they could apply them in their clinical setting at whatever level. It might be personal, it might be the organisation, it might be the ward, it might be the entire trust, but wherever, start somewhere and try and make a difference. So thank you very much. Thank you, Joanne. Thank you, Peter, for joining me today for what's been a really interesting and thoughtful discussion about the harm patient pathway. Thank you so much.